Crease disappeared after ptosis repair. Could revision surgery recreate a crease? I had surgery 11 months ago to repair a congenital left ptosis with minor blepharoplasty. I no longer have a definitive eyelid crease and feel I look more asymmetrical now than before surgery. I also feel that I still have some residual ptosis. I look forward to any advice.
Thank you for your question. You submitted a single photo and with a history where you describe having undergone ptosis surgery for congenital ptosis approximately 11 months ago, and you state in your question that you have a concern about the absence of a defined crease in the left eye and some residual ptosis. In addition, you comment that you feel that you're more asymmetric than you were prior to surgery, and you're looking for some guidance. Well, I can certainly share with you how I evaluate a patient like yourself in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and ptosis surgery is one of the most common procedures we do in our practice. And so certainly for your situation, I can give you some ideas. However, there is probably would be some benefit related to additional information that could be helpful. But just to basically remind you of the issue with congenital ptosis. First of all, congenital meaning you were born with this ptosis, and what the issue is with congenital ptosis is that the muscle that lifts the eyelid, called the levator muscle, levator like the word elevator, did not develop quite properly. And there is a spectrum of how much impact the congenital issue is. That's based on level of the eyelid relative to the pupil, so mild, moderate to severe, and then the amount of muscle function, how well the levator muscle contracts. So we can have anywhere from minimal function or almost zero function or 0 millimeters of movement to excellent muscle function. Based on that combination, a ptosis surgeon will then determine how to do your operation. Now, in our practice for adults, depending on their type of ptosis, the majority of our patients will actually do the procedure under local anesthesia with light sedation. One of the biggest challenges with ptosis surgery is trying to achieve the optimal height and contour to maximize symmetry. So we'll actually, during surgery, sit someone up during surgery to see their eyelid levels and do a comparison and make sure that we achieve that optimal goal. Now, to address first the issue about the crease. The eyelid crease is a function of the amount of skin that there is available to fold over. So when you look at your right eye where you have a little bit of hooding or a little bit of extra skin, and in the left eye, the operated eye, you notice there's very little additional skin. So the question that first comes to mind is, was there, since you did have a blepharoplasty, there was probably a discussion about the extra skin. So that means that likely you had skin removed with the intention to try to improve the hooding on that eye. Now, when that occurs, it is clear that there is a difference between the amount of skin over your eyes, and that I think may be the core issue of the asymmetry. In so many ways, when we're trying to do an operation like this, if the person doesn't want to have a blepharoplasty in the other eye, where there is extra skin, then very limited blepharoplasty is typically undertaken. And at times I will try to avoid removing any skin at all. I just use the eyelid crease to enter this space in order to address the levator muscle. In some ways, this is analogous to what we do for Asian eyelid surgery. With Asian eyelid surgery, the intention is to create a crease, but it is critical to maintain a certain amount of extra skin so that there's a fold and that the fold is able to overlap and create a natural crease. Now, in terms of the eyelid level achieved, looking at your photo, it seems that the symmetry is pretty much there. And the way I determine that is looking at the eyelid margin relative to the pupil, to the center of the pupil. And what I typically explain to every patient who's going to have unilateral surgery, unilateral ptosis surgery on one side, I explain that the goal is to maximize the symmetry. We want to get you as close to the other eye as possible. However, it's important to understand that within a range of normal, which is the general population, people without clinical diagnosis of ptosis, the majority, it is the norm to have both eyes have up to a 2 millimeter difference between them, and it still looks natural and symmetric. You know, the human body is beautifully imperfect. When we talk to patients about doing fillers or volume or facelifts, I always make a point to point out how different one side of the face is with the other. So in terms of the height of your eyelid margin relative to the pupil, you are probably as close as can be expected, and there probably is no additional value in doing more surgery. However, a solution worth considering in terms of maximizing symmetry would be to consider doing a contralateral or a blepharoplasty in the right eye, because that way you will at least have more balance between the two eyes. Now, I'm sure this was probably discussed with your doctor prior to surgery. And in terms of trying to create a crease, the limitation in this situation is how much skin is available to fold over. And based on the photo that you submitted, it doesn't look like there's enough skin so that even if a crease was to, quote, be anchored, and that's a technique to try to define a crease, the anatomy of the shape of the eye socket and the amount of skin that's available is likely to limit any kind of meaningful change with any surgery for crease formation. So I think that my impression is that the overall issue with the symmetry is more about the asymmetry between the hooding on one eye compared to the absence of hooding in the other eye. So if the goal is now to have better symmetry, then I would suggest considering having a right upper eyelid blepharoplasty. I think it's very important you have this discussion with the operating surgeon. I think that your overall result, if the goal of the ptosis surgery was to lift the eyelid, based on this photo, your objective has been achieved. Now, to maximize cosmetic symmetry, consider the right upper eyelid blepharoplasty. So I hope that was helpful. I wish you the best of luck. And thank you for your question.